So a very good afternoon to one and all present here. And I would like to thank AIOS for allowing me to represent my state on this platform. I'm here to present clinical appearance versus histopathological diagnosis in benign soft tissue tumors of the eyelid. Eyelids are as we all know, are the mobile tissue curtains placed in front of the eyeball. The anatomy, as far as the benign tumors are concerned, is really very important. The skin being the thinnest in the body. Then, as we all know, the layer of striated muscle in the form of orbicularis, the submuscular areolar tissue, the layer of fibrous layer in the form of tarsal plate and the orbital septum, and the innermost being the conjunctiva. So in spite of being a small organ, the eyelids contain numerous histological elements that can be the origin of various malignant and benign tumors. It's important to make a mention of the important glands present in the eyelid in the form of gland of Zeiss, Mole, the Meibomian glands, and the accessory lacrimal glands of Cross and Wolfram, which can lead to the numerous benign tumors of the lid. So 80% of the soft tissue tumors on the lid are benign in origin. They can be either developmental, as you all know, in the form of dermoid or epidermoid cyst. They can be inflammatory like a lesion. They can be infectious or vascular like hemangioma and the benign cyst, and the most importantly, the pre-malignant ones. Accurate diagnosis of any benign tumor of the lid, it is based upon history and clinical examination, like a patient of chalazion comes to us or molluscum comes to us. It is a spot diagnosis. But when in doubt, any suspicious lesion should undergo excision biopsy for confirmation of diagnosis by histopathological examination. Here, I am there to offer a case series of some interesting eyelid lesions which turned out to be histopathological surprises. So my first case is the conjunctival choristoma masquerading as nasal pterygium. This 70-year-old male presented with the complaint of diminution of vision, foreign body sensation in his left eye for the past 1 year. This patient, visual acuity was 624 owing to the nucleosclerotic cataract he had. But this patient also had a pterygium in his eye which extended to a cyst-like growth in the inferior fornix. The mass was oval, translucent, and it was like 4 mm in size. Surgical excision of the pterygium was planned, and the cyst was excised and sent for histopathological examination. Now, as you can see in the histopathological picture, it revealed hyperplastic stratified squamous epithelium with attached sebaceous gland, hair follicles, and lacrimal gland, and suggestive of conjunctival choristoma. So a small mass in the pterygium, it turned out to be a choristoma. It was a histopathological surprise for us. The second case is the appearances can really be deceptive. Again, a 40-year-old male presented with slowly progressive mass just below the left brow region in the orbital part of the eyelid. The mass was oval, soft to firm, well circumscribed, about 2 to 3 centimeters in size. The overlying skin was normal. I don't have the pre-op picture because we didn't think it will turn out to be something like this. And what could be the differential diagnosis of such a nodule? Was it a solitary neurofibroma or any fibrous tumor? So again, excision biopsy was done, and to our surprise, intraoperatively, it was a deep red, highly vascular lesion, as you can see. And I think you can be able to make out from the histopathological slide itself that it shows dilated vessels, vascular channels lined by a single layer of epithelial cells, which is diagnostic of cavernous hemangioma. So a patient presenting with a solitary nodule in this age and such a big size, it turned out to be a cavernous hemangioma. Now, what is your spot diagnosis? Another male, 40-year-old male, he presented with slowly progressive growth over left upper eyelid. So was it an epidermal inclusion cyst or a sebaceous cyst? What was it? Again, excision was planned, as you can see in the intro picture. It was excised in toto and sent for histopathological examination. And you can very well see in the slide, it shows stratified squamous epithelium with collagenous stroma, and it was suggestive of epidermoid cyst. Now, last but not the least, the first picture, we all know it is a case of neurofibromatosis. But the second male, he came to our OPD for excision of this large nodule-like thing present on his left upper lid. But before taking the patient for excision, we referred back the patient to a dermatologist, and the spot diagnosis of Favre-Racochet syndrome was made. It is because of chronic exposure to the UV rays of the sun, which leads to solar elastosis and resulting in cyst-like structure. So collaboration between ophthalmologists, dermatologists, and pathologists is often required. And benign lesions need to be differentiated from pre-malignant lesions, and complete workup needs to be done. Thank you.
Thank you, Dr. Mukta. It's not a epithelial cells in the cavernous hemangioma.